Welcome to Dignity Health Social TV. Today we're talking to neurologist Dr. Helseth.
Good to be here.
Yeah, we're talking stroke. What is stroke and how common really is it?
Stroke actually means a lot of different things. It's not just one sort of entity. There's a lot of different parts to it. And it's the unifying part of stroke is that it's a sudden disorder that affects the brain, usually from some blood vessel problem. And it could be the most common cause is a clot travels to the brain and interrupts blood flow to the brain, and the brain stops functioning as it normally should. That's one of the most common. Other causes are certain types of bleeding in the brain from aneurysms or for other blood vessel disorders. So stroke itself is a big term, means a lot of different things, but what people will normally see is sudden onset of some symptom where they have paralysis on one side or another, or weakness on one side or another, sensory loss, difficulty talking, or other sort of symptoms. And that's sort of the hallmark of stroke. But just based on symptoms alone, you don't necessarily know what's going on. It usually takes some evaluation to figure out what exactly the process is. Stroke itself, as a big topic, more than 800,000 strokes occur in the U.S. per year, and it's one of the top causes of disability in the U.S. So it's actually, in reality, a fairly common disorder and can occur at any point in someone's life, from childhood to adulthood. Much more common in adulthood, but the reasons stroke occurs change with time. Reasons that a young person might have a stroke are very different than reasons an older person might have stroke. But nonetheless, it can occur at any point in time.
And medicine, like the field of medicine, is rapidly progressing. What are we seeing new in the area of stroke?
Yeah, medicine is continuously evolving. There's lots of stuff going on. It's a very exciting field to be in, essentially no matter what part of medicine you're in. Specifically on the stroke front, there are some very recent developments just in the last year that have completely revolutionized how we treat stroke. So historically, before 1996, there were no treatments for stroke. If you were having an event, you were admitted to the hospital and they tried to figure out why, but the care was largely supportive. It wasn't designed to undo the stroke or salvage brain tissue. In 1996, we got this new clot-busting medicine, which is called TPA, and that had the ability to open up some blood vessels that were blocked off, restore blood flow to the brain, and essentially undo a stroke. The problem with the medicine is that not a lot of people could get it. There are some significant possible complications from giving that medicine, and it only worked a small fraction of the time. And so basically the last 20 years have been looking at what can we do to restore blood flow to the brain if there's a clot that's interrupting blood flow. And the techniques that have evolved basically are going inside the arteries of the body, usually through the leg, and working our way up into the brain and snaring a clot, pulling it out of the brain and restoring blood flow. And so those techniques really started in the late 90s, but it's been a 20-year process of developing the techniques, coming up with the right equipment, something that was effective at opening up arteries, safe at opening up arteries, and defining who's a good patient for this procedure, what are the methods we're going to use, and does it work? And that basically all culminated, in a bunch of studies that were finished and published in 2015. There were 5, landmark trials that looked at this and said, you know what, this does work. This is a very effective, very safe treatment to essentially undo stroke. So there's only a limited number of people that are eligible, but when someone's having a stroke, you don't necessarily know what sorts of treatments they'll be eligible for. The important thing is that folks that come in and get evaluated, and that they be aware that those treatments are developed and are potentially available.
As a patient, like if I were a patient, a stroke patient, what are some of the things that I should be looking for as far as receiving proper stroke care?
So, stroke care is a systems kind of a thing. So you need a system in place, and you need the experts in place, and you need the facilities in place. And that's going to be the best way to ensure that you get the proper care. So this is, in some part, it's a hospital effort, and in some parts, it's a community effort. And some communities don't have everything they need, and they send patients to places that do have everything that's needed. And so, for example, we'll take patients from outlying communities, take their stroke patients in and give them that acute sort of a care. But it's not available everywhere, and so the communities essentially need to be familiar with what services are offered, and if not here, then where. Obviously, the greatest thing that anyone could do would be to prevent a stroke before it occurs, and so there's a lot of strategies for preventing stroke. That's an important part of the treatment of stroke, is let's keep this thing from happening in the first place.
So what would be some of our responsibilities?
The important things there are really, probably for most folks, it's going to be to work with your primary care doc and say, do I have any particular risk factors for stroke? Is there anything, any reason that I may be at a higher risk than anybody else? Obviously, for a huge number of people, they don't have any particular risk factors. They don't need to do anything special. For some folks, they've got diseases that put them at increased risk. It can be cholesterol problems and diabetes and high blood pressure, all sorts of things. And so folks need to work with their primary care docs and say, am I someone who's at increased risk? And if so, what is the right strategy to prevent strokes? There's a lot of research to be done as far as diet and exercise and other things, and that's going to continue to evolve. But certainly being in good shape and regular physical exercise and is going to be an important part of that. That's a little bit harder to find, and we'll learn more about all that sort of stuff in the future. And then the other big responsibility I think that a patient would have is know what is a stroke, what does it look like, and what do you do when one occurs. There's an unfortunate tendency that patients have to kind of want to see how things go, and they may go to sleep or say, well, I'll maybe if this hasn't cleared up in a couple of hours, I'll go seek care. Unfortunately, that can really set us back in terms of getting them emergent treatment. So, the important things, most common things would be weakness or numbness of the face, so a facial droop, paralysis on one side of the body or the other, difficulty talking. Sometimes it's slurred speech, sometimes it's nonsensical speech. In coordination, but generally speaking, it's some sudden onset change that says, my brain is not working. And those are the key things to recognize and say, this could be a stroke. And the next step is always, call 911. Again, I can't tell you how many times I've had folks come in and they say, well, it started last night, I thought I'd just go to bed and see if it was still there in the morning. And unfortunately, then the treatments are too late at that point in time. So it's so important to call.
So pay attention to the symptoms. If you feel like you have even remote symptoms, seek out the help of a physician.
Exactly.
That's awesome.
Exactly.
Thank you so much for hanging out with us, Doctor.
You bet.
Appreciate
Thank you very much.
Yeah. Thank you for watching Dignity Health Social TV. For more information, you can visit mercy.org.